Hi, my name is Ginny Beatty. I'm a nurse practitioner student at Maryville University, and this is my head-to-toe assessment for nurse class 612. Prior to entering the room, I've asked Anne to get into comfortable clothing. She's emptied her bladder. I obtained a set of vital signs, got her height and weight. We did a Snellen and a Rosenbaum vision test for near and distant vision prior to coming into the room, and that was assessing cranial nerve 2. As she entered the room, I noticed that her gait was steady. Her neuro's alert and oriented. She's been answering me appropriately. She complains of no numbness or tingling to her extremities. And as we go along, I will be assessing her skin. And now I have washed my hands, and I will begin my assessment. I will begin with inspecting her head and skull. Her skin is pink and normal. Her hair is fine and equally distributed. There's no thinning noted. I will palpate her facial bones, and as I palpating her scalp moves freely. Her facial bones, as I palpate them, she's complaining of no tenderness. I will go and assess her frontal sinuses for any tenderness, and her maxillary sinuses. I will now move on to the transmandibular assessment. I'm going to have her open her and close her mouth, looking for popping, clicking, and snapping. And any complaints of pain at all? Okay, great. That's assessing, oh, I'm sorry. I'm going to move on to now, and what I want to do is have you, I'm going to assess cranial nerves 5, 7, and 12. Doing that, what I want you to do is raise your eyebrows, close your eyes tight, clench your teeth, puff out your cheeks, stick out your tongue. Okay, those appear to be intact. I'm now going to move on to testing her light sensation. So I'm going to have you close your eyes and let me know where I'm touching you.
Forehead, left cheek, right cheek, chin.
Very good. That's intact. I'm now going to move on to inspecting her eyes. As I look at her face, I see that her eyes and nose and ears are all equally, symmetrically in line with one another. Her eyelash or her eyebrows, the hair is evenly distributed. It reaches out to the temporal areas. Her eyelids, there's no signs of orbital edema noted. Her eyelashes go outward and upward. And I will grab my light and I'm going to assess her sclera. Her sclera is white with no signs of jaundice noted. I look at the conjunctiva. It's pink and moist. There's no signs of eye drainage present at all. I now will palpate the eyelids, and I'm palpating the lacrimal apparatus, and it is not firm. There's no tenderness noted. I will move on to the red reflex. Okay. The red reflex is present in the right eye and in the left eye. I will now do the pupillary response, and I'm going to look for direct and consensual responses. The eye that I'm shining the light in will be the direct response, and the light that I'm shining, that I'm looking in the other eye for a response, and that's the consensual response. So we've got direct and consensual, and direct and consensual response. Very good. I will now do the cover and uncover test. What I want you to do is place your hand over your eye and then remove it and do the same with the other eye. I'm looking for any involuntary eye movements, any strabismus, and nothing is noted. That is assessing for, I will do the visual cardinal signs of gaze right now. This is going to be assessing cranial nerves 3, 4, and 6. So what I'm going to do is have you follow this object, keeping your head steady, and just follow it with your eyes, okay? Great, and accommodation is also noted to be intact. I will now move on to your ear inspection. As I look, I will do a general inspection of her ears, and her ears are symmetrical. They are even with the eyes. They're not low set. I will palpate her auricles. The auricles are free of no lumps, lesions. And now I will do a whisper test. So I want you to tell me what you hear.
Hello.
Very good.
Goodbye.
Very good. All right. Now I'm going to test some auditory tests on you. The first one I'm going to start with is the Weber test. What I will do is place this on the midline of your head, and I want you to tell me if you hear it in the left ear, the right ear, or both ears equally. Okay? Very good. Okay. Next, I'll move on to the Renee test. And what the Renee test is going to be doing is I'm going to strike the tuning fork, place it on your mastoid bone, and then have you listen for the sound until you no longer hear it, and then I will move it towards the side of your ear. I want you to let me know when you no longer hear it at that point. Okay? Good. Actually, air conduction was longer than bone conduction, as that's a normal finding, and that's what we wanted to find. Okay? If I had time, I would have done it on the other ear also. I'm now going to get the otoscope, and I will take a peek in your ears. Due to time, I am going to just assess the one ear, but I would actually do this test in both ears if it was a normal assessment. As I inspect the ear, I note that the landmarks are in place. Her tympanic membrane is pearly gray. I don't see any redness, drainage. There is normal cerumen in the ear canal. And that has tested for, during that test, the whisper test, I did assess cranial nerve number 8. I am now going to move on to the nose. As I look at your nose, I see that it's midline. There's no signs of any scars of any kind of lumps or lesions noted on it. And I will have you test the patency of your nostrils first. So plug one side and sniff. And is that equal on both sides for you?
Yes.
Okay, good. Now I'm going to take a peek into your nose and inspect the nasal mucosa. As I look, I see that the septum is intact, the turbinates, there's pink, moist, and there's no signs of any polyps or deviated septum noted. Now I'm going to have you close your eyes, and I'm going to have you tell me what you smell.
Alcohol.
All right. By doing that test, that was testing cranial nerve number 1, which is intact. I will now move on to the mouth area. As I inspect, I note that your lips are moist and pink. There's no signs of any cracks or fissures noted. I will have you open your mouth. Tongue depressor. And I'm looking at the hard and soft palate. They're pink and moist. The buccal mucosa is pink. Everything is moist. I don't see any masses, lesions, any sores in the mouth. Your teeth are white. There's a few fillings noted. Otherwise, all teeth are intact. I'm going to have you lift up your tongue. I look on the floor of the mouth. I don't see any masses or lesions noted. I'm going to have you stick out your tongue. The tongue is pink and moist. No signs of plaque. I'm going to have you move your tongue side to side. I don't see any masses or lesions present at all. This is assessing cranial nerve. Oh, I'm sorry. Here, wait, let me finish my thing. I'm going to go, say ah. All right, the uvula is midline. Your tonsils are about a 1+. There's no redness, no exudate noted in the oral cavity. The Anterior posterior pillars are intact. Your tonsils, I've already assessed. Let's see here, we're gonna do a swallow test. I'm gonna ask you to swallow. Was there any trouble with that?
No.
Okay, cranial nerve 10 is intact. Now I need to do something horrible and test your gag reflex.
Okay.
So. Very good. Gag reflex is intact. All right, we're going to move on to your neck. I'm going to first inspect the neck. As I look at the neck, I note that there's no signs of any scars, lesions, or masses present. I'm going to have you turn your head. No pulsations are present. There's no jugular venous distension noted. Anyway, I'm going to palpate. As I palpate, I'm going to check your thyroid. Let me go around here. Trachea is midline, and I'm going to be swallow for me. And the thyroid is non-palpable. Okay, I'm going to assess, I'm going to check your carotid pulses one at a time. There, 2 plus. Good. Now I'm going to auscultate using the Valley stethoscope. What I'm auscultating is your carotid and your thyroid, looking for bruise. Good, no bruises are present. Next I'm going to move down to the lymph nodes. So I'm going to start with the occipital, postauricular, preauricular, tonsillar, submandibular, submental, the superficial cervical chain, the posterior cervical chain, and the deep cervical chain. Moving down, I'll move to the supraclavicular. I'm going to have you bring your arms out. We'll set the axillary nodes and then the epitrochlear nodes. No nodes are palpable. I don't see any redness or streaking present either. Okay? Next, I'm going to move on to assessing some range of motion. So what I'm going to have you do is turn your head, bring your head chin to chest, back, turn left, turn right, shrug your shoulders. Okay, now I'm going to have you do that against resistance. Good. 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 The range of motion is intact, and that's testing cranial nerve 11. We will move on to your upper extremities. As I look at your upper extremities, your skin is pink and moist. There's no signs of any lesions, masses. You have some tattoos present, but other than that, there's no other abnormalities on the skin. And I will assess your cap refill. I don't see any clubbing of your nails. Your cap refill is less than 2 seconds. Let me test your brachial. Radial and brachial pulses. And I would do that on both arms, okay? Can you go like this for me? Do some range of motion. Good, range of motion is intact. All right, I'm gonna have you turn around if you don't mind. And I'm gonna do the posterior chest inspection now. As I'm looking at inspecting the back, I'm looking for any masses, lumps, lesions, any kind of changes that are not normal, and I don't note anything. I will palpate, noting no change. And now what I'm going to have you do is I'm going to ask you to say 99 as I check for tactile fremitus.
99, 99, 99.
Very good. It's equal. There was no change in the pitch of high or low. I will now percuss the back in a systemic fashion. Good. to have you raise up your arms for me. Very good. I will now assess your diaphragmatic excursion. What I need you to do for this test is I need you to take a deep breath in and hold it, and then I'm going to mark a spot.
Okay.
Okay, take a deep breath in. And I'm looking for the sign where I reach dullness. Okay. All right, and you can breathe normal. And now I want you to take a deep breath in and exhale. And hold it. Okay. And that measures about 3 centimeters, which is normal. I will now move on to auscultating your lungs. And I'm going to have you take deep breaths in and out. And I'm going to listen to your lateral sides. And I'm hearing clear breath sounds with no wheezing or rhonchi present. I'm going to have you turn around and sit down now. And I will inspect your anterior chest. As I inspect the anterior chest, I'm looking at the skin once again, and I note that there's no lesions or scars present. Your respiratories are unlabored. Your chest rise and fall is symmetrical. There doesn't appear to be any respiratory distress noted. As I look, I don't see any pulsations or heaving noted in the chest area. I'm going to palpate. Looking for lumps, tenderness, lesions. And then I'm going to assess the precordium. There's no thrills, heaves, or pulsations noted. I will look for the apical impulse, and it's at the left fifth intercostal space, 4 centimeters lateral. And it is present. Okay. Now, once again, we're going to do that test where you say 99 while I hold on to your chest, okay?
99, 99, 99, 99.
Very good. I am going to percuss the lungs now, with renaissance being the expected sound, and dullness being the unexpected sound. Very good. I will now move on to auscultating your lungs. I'll first auscultate the lungs anteriorly, and then I will listen for heart sounds. So we'll start with your lung sounds. Deep breaths in and out. Good. Now we'll assess your heart sounds. I'm assessing the aortic, the pulmonic, Erb's point, the mitral, and the tricuspid. As I listen to your heart sounds, I'm hearing normal heart sounds, S1 and S2. I don't hear any abnormal rubs or murmurs present. I'm now going to have you lie down, and we'll start with your abdominal inspection. Before we do that, I need you to turn around. I forgot to do the chest expansion. So I'm going to do that quickly. Okay, take a deep breath in and out. While you're doing that, I note that your chest rises and falls symmetrical, and there's equal expansion on both sides. Okay, now we'll do the abdomen. All right. What I would do, I won't ask you this, but we would normally look at the abdomen and inspect it, I would be looking for any pulsations, any masses, which would indicate possibly a hernia, or any scar tissue, any scarring at all. So, I will listen to your bowel sounds now. Okay, and I'm going to auscultate all 4 quadrants. And I have normal bowel sounds. I will now listen for your arteries. I'm listening for the aorta, the renal, right and left side, the iliac, right and left side, and your femoral, right and left side, and they are present. I'll now move on to percussing your abdomen. And what I want to hear is tympany, which is what I'm hearing throughout. If I was over the spleen, I would be hearing dullness, which is a normal, and also over the liver area. I'm going to assess your liver border. Mark that area, and then come down. And your liver border measures about 8 centimeters, and that is normal finding also. Next, I'm going to move on to light palpation of your abdomen. I want you to let me know if this is tender anywhere. No tenderness? No? Okay. Then I will go into deeper palpation. I'm assessing the left costal margin, and I am not palpating the spleen at all. I will move over to the right costal margin, assessing for the liver, and I note that the liver is approximately 2 centimeters below the mid-costal region. I want to check for your kidneys, so what I'm going to have you do is take a deep breath, load up, okay, and the same on this side. Very good. All right. I don't note any aortic pulsations at all. And what I'm going to do now is look at your abdominal muscle tone, and muscle tone is normal and healthy. We're going to move on to your feet and legs. As I look at your legs, I note that the skin is pink and warm. There's no signs of lesions, any masses, no bruising noted, no hair. Obviously, you shave your legs. And there's no edema present. I'm going to move on to palpating your pulses. I'll first start with the popliteal, and I would do this bilaterally. The dorsalis pedis and posttibial. Pulses are all present and equal. I'm going to have you now turn and sit down here. And then I'm going to check your reflexes. Okay. Let's start with the toe. The Achilles. Very good. Good. All right. That concludes my video presentation, and thank you.